everyone, welcome to TTV News with some latest events in TayNinhTV province. And now we come into details. Ladies and gentlemen, a national online conference will have on the 4th of August to review the performances of the National Steering Committee for Anti-Smuggling, Counterfeit Goods and Trade Routes in the first 6 months of 2022 and identity its tasks for the rest of the years.
The virtual event was presided by Permanent Deputy Prime Minister Phạm Bình Minh, head of the National Steering Committee of 389. According to the data reported at the conference, in the first 6 months of 2022, a total of more than 54,000 cases of smuggling, trade fraud, and counterfeit goods were detected and handled across the country in the first half of this year, down to 75% compared with the same period last year, of which over 5,700 cases were involved in illegally transporting banned and smuggled goods, over 47,700 cases of commercial fraud and tax fraud, and the cracking down of smuggling, trade fraud, and counterfeit goods helped add nearly 3,728 billion Vietnam dong to the state budget. In his closing speech at the event, Permanent Deputy Prime Minister Phạm Bình Minh acknowledged and praised the National Steering Committee 389 for its great efforts in the fight against smuggling, counterfeit fraud, and counterfeiting goods in the first 6 months of the year. In addition to pointing out some shortcomings and limitations in the National Steering Committee's performance, the Deputy Prime Minister asked the agency and ministry branches and localities to do well in capturing and forecasting the situation, strengthen the fight against smuggling, counterfeit, commercial fraud, and counterfeits and poor quality goods, especially before, during, and after the Test Festival of 2023. And ladies and gentlemen, in order to satisfy the urgent need of housing for low-income people, ensure the social security and promote the development of the local economy, the Bank for Social Policies of the TayNinhTV province has implemented the following: effectively implement the social housing loan program according to the government's resolution number 11, dated January the 30th of 2022. Accordingly, the transaction officers of Bank for Social Policies of the district, town, and TayNinhTV city have coordinated with the social political organizations to strengthen the dissemination of documents and guidelines of the Vietnam Bank for Social Policies to help people understand and participate in credit loans. At the same time, organizing training on the process, procedures, loan documents to communes, townships, and mass organizations providing trust services, saving, and loan groups. On the basis of the list of registered subjects, mass organizations shall coordinate with the commune-level People's Committee to make comments, and district social policy bank staff will apprise and guide the completion of loan documents, ensure publicity and compliance with regulations. By the end of July of 2022, the Bank for Social Policies of the TayNinhTV province has disbursed to 38 customers with a total amount of over 12.5 billion Vietnam dong from the social housing loan program, according to the resolution number 11 of the government.
TayNinhTV province has sent an official dispatch to related units on promoting the pilot implementation of the use of chips paid citizen IDs in medical care of the health insurance.
In order to successfully implement the digital transformation goals set by the government, recently the Social Insurance of the TayNinhTV province has sent an official dispatch to the Department of Health facilities that sign contracts for medical examination and treatment with the health insurance on promoting the pilot implementation of the issues of the use of chip-based citizen IDs in the health insurance system of medical care of the health insurance. Accordingly, the social insurance sets a target that 100% of health insurance facilities in the province implement the use of citizen ID with chips in medical examination and treatment on August 15 of 2022. And by the end of June of 2022, the province has nearly 525,000 citizen IDs synchronized with valid health insurance cards for medical examination and treatment. Currently, the whole province has 27 medical examination treatment facilities that took up and scan QR codes for the people's citizen IDs when going for medical examination and treatment, with over 5,700 successful search using citizen IDs instead of health insurance cards for medical examination and treatment.
Recently, the People Committee of TayNinhTV province issued a plan on promoting non-cash payments in school educational institutions, hospital and medical facility by 2025 in TayNinh province.
The People's Committee of TayNinh Province issues Plan number 2349 on promoting non-cash payments in the school and educational institution, hospital and medical facilities by 2025. Accordingly, by the end of 2022, 50% of school and educational institutions, hospitals and medical facilities in the province will use digital platforms and using cashless methods to pay for tuition, hospital fees, and other transactions. And by 2025, 100% of school and educational institutions, hospitals, and medical facilities in the province will use digital platforms to not use cash to pay for tuition, hospital fees, and other transactions. The number of non-cash payment transactions at school, educational institutions, hospital, and medical facilities in the province reached over 95%. And ladies and gentlemen, in some areas of newly established wards, the situation that the people still maintain livestock in the polluted neighborhoods is something that voters have urged to propose in the city to quickly have solutions to clear the spot and this livestock also. At the number 19 settlement of Nintum Hamlets in some wards, there is a household that has built a coal shed for more than 3 months, and since this household rice coals, wastewater often overflows, and neighboring households are suffering from the bad smell. Now it's a city, it's an urban area, and it's a clean neighborhood. But why are the households close to the rising livestock, polluting the environment and affecting the people's lives? This area is quite densely populated with field gaps, and therefore livestock farming in urban areas pollutes the environment and affects the people's health. The citizens here also sent application. The neighborhood had no reminders, and the ward delegation has come to remind the family. And according to Resolution number 17 of the Provincial People's Council issued in December of 2021 in the city, the area where livestock is prohibited in the city does not include in some ward. However, with the current dense population density, livestock production in the residential areas will certainly cause a lot of frustration, especially when livestock households do not cooperate to solve environmental pollution. And voters of new established wards such as Ninh Thành and Ninh Sơn wards suggested that the city soon review and add areas where livestock is prohibited in these two wards for the people to implement.
Ladies and gentlemen, after 2 years of fighting against the pandemic, Bradford's health sector is currently facing a serious shortage of medical staff. Those who remain in state-run health facilities are helping to perform a huge amount of work, but their income is very low. Some policies have not been implemented yet.
From the beginning of 2022 until now, Tân Châu District Medical Center has 8 people quit, including 2 doctors, and in the past few years the number of officials taking the strength exam was modest, and the center did not have enough people to advance the work. And now, the situation of doctors and nurses applying for leave in serious makes the operation of medical facilities in Tân Châu District under great pressure. Currently, there are 9 unresolved resignation applications. The rest of the medical staff are not satisfied with their work because they have to shoulder the burden of those who quit. And the Emergency Resuscitation Department of Tân Châu District Medical Center worked very hard. There have been a number of doctors and nurses of the department resigning to move to private hospital to work. My emergency department has a serious shortage of nurses in terms of nursing, so every 1 day off and 1 day you are very tired. You have to go on duty the next day after leaving the shift, and very hard work, almost impossible. Excessive workload pressure is one of the 2 main reasons why healthcare workers leave or quit. The second reason is that the income for medical staff in public health facilities is currently too low. I've worked for 5 years now and my salary is about 5 million Vietnam dong. Only than that, there is no other income. I have a family and the salary is not enough for my support my family, and therefore I really loved the profession, but now I no longer think about sticking with the medical profession for a long time. And compared with many other jobs, the allowance coefficient of the health sector is still lower than the general average. In addition, after the split operation model of combat of the COVID-19 pandemic up to now, a number of medical staff policies have not been resolved in a timely manner, and many people who want to work part-time to improve their income also do not have the time and the health to do so. And currently, the non-health sector lack of 845 personnel, equivalent to about 24.6%. And from the beginning of 2021 up to now, 210 health workers have quit a job, including the reasons of job transfers, applying for a job application, etc., to leave, quit, and retire, etc. In the past, the background was already lack of the personnel, so there was a shortage of 210 people. The situation is more serious. In the past 2 years, we have not recruited, but only words about fighting the pandemic. We only have the output, but no import. Some nurses of district health centers are quitting their jobs, have chosen the jobs with less pressure than medicine in the current period, but with better income. And if in the near future it is not possible to guarantee the life of health workers at a basic level, the shortage of medical staff is forecast to be even more serious.
Ladies and gentlemen, that's all for TTV News today. Thanks for joining with us and see you next time.